A 32-year-old man in unresponsive state. Clinical case. A 32-year-old incarcerated man was admitted to the hospital after being found in unresponsive state in his jail cell. 2 days before, the patient had had nausea and vomiting. Acetaminophen at a dose of 650 mg up to 3 times daily as needed was prescribed, in addition to a persisting prescription for acetaminophen at a dose of 325 mg twice daily. Earlier during the day of admission, the patient was reported to be acting strangely. Later, he was found in unresponsive state on the floor of his cell. Emergency medical service personnel were called to the jail, where they found the patient in an unresponsive state, in a disorderly posture and incontinent of urine. The available medical history was limited. The patient had a history of substance use disorder, including the use of alcohol, opiates, and cocaine, traumatic brain injuries, seizures, anemia, and psychotic disorder for which the diagnosis of paranoid schizophrenia had been considered. 6 years before the current presentation, test for human immunodeficient virus antibodies and hepatitis C virus antibodies was positive. He had jaundice and encephalopathy. Jaundice is a yellowish discoloration of the skin, mucous membrane, and of the white of the eyes caused by elevated levels of chemical bilirubin in blood. Jaundice is typically seen when the level of bilirubin in the blood exceeds 2.5 or 3 mg per deciliter.
Doesn't have the most intuitive name, comes from the French jaunisse, meaning yellowing. It's also sometimes referred to as icterus, though, the origin of which is even less intuitive, coming from the thought that jaundice could once be cured by looking at a yellow bird. Well, the more you know, right? Jaundice involves somewhat on yellow pigments in eyes. Bilirubin, a component of bile and the main cause of bruises being yellow, and, after its metabolism, the yellowness of urine and brownness of feces. So since bilirubin's our main culprit of yellowness, it's super important to know where it comes from. As red blood cells near the end of their lifespan, which is about 120 days, they're eaten up or phagocytized by macrophages in the reticuloendothelial system, aka the macrophage system, where the spleen plays the largest part, but it's also made of parts of the lymph nodes. Okay, so first the macrophage eats up the blood cell, and hemoglobin is broken up into heme and globin. The globin is further broken into amino acids. The heme, on the other hand, is split into iron and protoporphyrin. Protoporphyrin is then converted into unconjugated bilirubin, or UCB for short. Unconjugated bilirubin is the form of bilirubin that's lipid soluble, meaning it's not water soluble, right? Albumin in the blood then binds to unconjugated bilirubin and gives it a lift over to the liver, where it's taken up by hepatocytes and eventually conjugated by an enzyme called uridine glucuronyl transferase, or UGT, making it now water soluble. At this point, the conjugated bilirubin is secreted out into the bile caniculi, where it drains into the bile ducts and is sent to the gallbladder for storage as bile. Now, when you eat a donut or something, your gallbladder secretes the bile, which has the conjugated bilirubin in it, and it moves through the common bile duct to the duodenum, the small intestine, and is converted into urobilinogen, or UBG, by intestinal microbes in the gut. Now some of that urobilinogen is reduced to stercobilin, which is excreted and responsible for the brown color of feces. Some of that urobilinogen is actually recycled though, and it gets reabsorbed into the blood and spontaneously oxidizes into urobilin, most of which is sent to the liver and some of which goes to the kidneys. It's then excreted and is responsible for the yellowness of urine. And there you have it, bilirubin metabolism in a nutshell. Now, if some point in this process gets disrupted, for example, if your liver cells are damaged and can't conjugate bilirubin anymore, or maybe if they die off and release their bilirubin, you can end up with increased bilirubin in the blood, which can be either conjugated or unconjugated, or both. and this is what accounts for the yellow color in the skin and the eyes. Usually it takes about 2.5 milligrams per deciliter or greater of serum bilirubin to give the skin that Simpsons-esque yellow skin tone. The earliest sign of jaundice and increased bilirubin in the blood is this yellowing of the sclera of the eyes. Scleral tissue is high in elastin, which has particular fondness for bilirubin and binds it with a very high affinity, giving that scleral tissue in the eyes a yellow color often before the skin. Now, as you might imagine, after looking at this process, there are quite a few potential pitfalls along the way that can lead to jaundice, and they're lumped together depending on whether they have more unconjugated bilirubin in the blood, or more conjugated bilirubin in the blood, or more of both in the blood.
Pros and cons. Pros. In general, living a healthy lifestyle can reduce your risk factor for brain disease. Avoiding excess alcohol, reducing exposure to toxic substances like drugs, eating a fatty diet, seeing your doctor regularly. Cons. Hepatic encephalopathy is characterized by personality change, intellectual impairment, and a depressed level of consciousness.
Methodist Hospital Medicine. Hello everybody. Well, thank you very much for looking at this video that we've put together for our patients and those interested in liver disease. I'm Dr. Joe Galati, and I'm the medical director for the Center for Liver Disease and Transplantation at Houston Methodist Hospital. Now, what I want to discuss here today is a disease and complication of liver disease and cirrhosis that our patients see. And the name of the condition is hepatic encephalopathy. Now, the proper pronunciation of the encephalopathy is encephalopathy. Now, in this condition, hepatic encephalopathy, our typical patient has a lot of symptoms, typically brain. And typically, we know that hepatic encephalopathy is a neurologic problem with both neurologic and psychological effects that can affect the brain. And you really get the sense that the brain just is not working correctly. And many times patients feel as if they are coming to an absolute screeching halt with all sorts of symptoms, including being tired, fatigue, and especially there's a confusion state that develops with our patients with encephalopathy, and they just don't feel themselves. Many times patients have trouble with work, taking care of themselves, and doing routine activities. And so hepatic encephalopathy is a condition that affects the liver, and usually it is only seen in patients with advanced liver disease or cirrhosis due to alcohol, hepatitis C or hepatitis B, or fatty liver. The major problem is that there is a buildup of toxins in the liver making you feel ill. Now, there's no doubt that hepatic encephalopathy is a very serious complication of cirrhosis, which is scarring of the liver. Now, once you have the hepatic encephalopathy and have cirrhosis, then in many times, the conversation that we'll have with our patients is that it may be time to start talking about liver transplantation. Now, the good news with hepatic encephalopathy is, first, it needs to be identified. The patient or the family members will speak with their physician and describe these symptoms of fatigue and confusion. There are medications that can be prescribed for the hepatic encephalopathy, including rifaximin, which is in capsule form, and lactulose, which is a non-absorbable sugar solution that traps some of the toxins in the person's digestive tract. But there is the ability to help these patients with hepatic encephalopathy. In speaking with patients, one of the biggest complaints is that this sense of tiredness. They feel as if they wake up in the morning tired and lethargic and just really feel pretty awful, and certainly are confused. The good news is that with early identification and treatment, patients can get treated. Now, of course, more information is available on hepatic encephalopathy.
Issue apply in Ecuador. This may consist of medication to treat your symptoms and medication or surgery to treat the underlying cause. Your doctor may recommend nutritional supplements to slow the damage to your brain and are especially to treat underlying cause. Thank you.